We carried out a thorough review of existing evidence on the implications of the COVID-19 pandemic and lockdowns on the mental well-being of children and young people. While COVID-19 emerged less than 2 years ago, there is already a lot of research on the topic.
The evidence overwhelmingly points to a very negative impact on all aspects of mental health among children and young people. Their emotional well-being showed a decline during the pandemic, especially in terms of increased stress. Some also exhibited worsening health behaviors like sleep disruption and unhealthy diets, and negative coping mechanisms such as substance abuse. There are also serious concerns about children and young people witnessing or becoming targets of domestic abuse and sexual violence during lockdown, especially given the lack of access to social support due to school closures and distance from friends.
School closures and lack of access to support at school were really a key factor behind many of the worries and anxieties that children and young people experienced during the lockdown. Also, many parents struggled during the pandemic and were hence unable to provide the necessary support to their children, while social distancing more generally intensified these feelings of loneliness and isolation.
Age was a huge factor. Adolescents and young adults were affected much more than older adults and younger children. Evidence also suggests young women and girls were more severely affected than boys. We also found that families on lower incomes and young people not in education or employment experienced the adverse impact of the pandemic much more severely. School closures disproportionately affected students from disadvantaged backgrounds who depend on free, non-academic services from schools.
Some of the things that helped were spending time outside, keeping physically active, engaging in creative activities and hobbies, and establishing healthy routines. Additionally, maintaining contact with friends online and being aware of the nature of the virus and how to prevent its spread helped reduce the negative mental health impacts of the pandemic.
The improvement in wellbeing measures for all age groups when restrictions were eased and schools fully reopened after the first lockdown suggests that some negative impacts of the pandemic could be short-lived. That said, the honest answer at this stage is that we simply don't know what the long-term impact will be.
Lockdowns actually had positive elements for some young people. For example, feeling relief from social pressure and bullying, spending more time with family, taking up new hobbies, and having the time to adopt healthier behaviors. It is important to keep this in mind and support children who have now returned to school.